Good afternoon, everyone. Welcome back. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, broadcasting live Apple Valley, People's Republic of California.
Yeah, and if you can't get charged up about this story, I don't know what to tell you. This is a really, really good story.
Yeah. Researchers have discovered that dormant breast cancer cells can be detected and wiped out with existing drugs, dramatically lowering the risk of relapse. That's cool.
Yeah.
The breakthrough brings new hope to survivors haunted by the fear of recurrence. The work, led by researchers at the Abramson Cancer Center of the University of Pennsylvania and Penn's Perelman School of Medicine, appears in the journal Nature Medicine on September 2nd, 2025. Would you like to know more?
A landmark federally funded clinical trial has provided the first real evidence that doctors can pinpoint breast cancer survivors at higher risk of relapse by detecting dormant cancer cells, and that these hidden cells can be successfully treated using already available drugs.
I like it.
Win-win here.
Although survival rates for breast cancer continue to improve, thanks to better screening and therapies, the disease remains incurable once it comes back after initial treatment. About 30% of women and men experience a relapse, leaving them dependent on ongoing treatment that cannot completely remove the cancer. Some forms, such as triple negative and HER2 plus, often reappear within a few years, while ER plus cases can resurface even decades later. Until now, doctors had no way to identify which survivors carry dormant cells and that fuel recurrence, or to step in with a therapy that could prevent it.
In the randomized phase 2 trial, 51 breast cancer survivors were tested with existing drugs, which successfully cleared dormant tumor cells in 80% of participants. After 3 years, the survival rate without any return of disease exceeded 90% among patients given a single drug, and reached 100% for those who received both medications.
Wow.
Can't get much better than that, right?
Right. Quote, the lingering fear of cancer returning is something that hangs over many breast cancer survivors after they celebrate the end of treatment, said Principal Investigator Angela DeMichelle, MD, MSCE, FASCO, the Marion T. and Robert J. McDonald Professor in Breast Cancer Research. Quote, right now, we just don't know when or if someone's cancer will come back. I mean, that's true. You never know. That's the problem we set out to solve. Our study shows that preventing recurrence by monitoring and targeting dormant tumor cells is a strategy that holds real promise, and I hope it ignites more research in this area, end quote.
The study builds on previous research that showed how dormant tumor cells continue to lay in wait in some patients after breast cancer treatment. These so-called sleeper cells, also referred to as minimal residual disease, MRD, can reactivate years or even decades later. Because they are not active cancer cells and can be scattered throughout the body, they do not show up on standard imaging tests that are used to watch for breast cancer reoccurrence.
Once the sleeper cells begin, you think of sleeper cell like a terrorist organization. Once the sleeper cells, these little tiny cells,
are, right?
Yeah, begin to expand and circulate in the bloodstream, it can lead to the spread of metastatic. Did I say it right? Metastatic.
Metastatic.
Yeah,
metastatic.
I'm going to sound it out here. Metastatic.
Yeah.
Breast cancer, but it sounds weird. Patients who have MRD are more likely to experience breast cancer recurrence and have decreased overall survival.
Louis Chodosh, MD, PhD, chair of the cancer biology and senior author of the study, previously led research to identify the pathways that allow dormant tumor cells to survive in patients for decades. Quote, our research shows that this sleeper phase represents an opportunity to intervene and eradicate the dormant tumor cells before they have the chance to come back as aggressive metastatic disease, unquote. That was according to Dr. Chodosh. He's a doctor, right?
Yeah, MD. Doctor.
Surprisingly, we found that certain drugs that don't work against actively growing cancers can be very effective against these sleeper cells. Interesting. This tells us that the biology of dormant tumor cells is very different from active cancer cells.
In the preclinical part of the latest research publication, Chodosh's team conducted a series of experiments in mice, we love that, to better understand the underlying mechanisms. They showed that 2 different drugs approved by the FDA to treat other conditions could effectively clear MRD in mice, resulting in longer survival without cancer recurrence. The drugs target autophagy,
Sounds good to me. Yeah.
and mTOR signaling, which the researchers found were key mechanisms to allow the tumor cells to remain dormant.
Dame Michelle's team first enrolled breast cancer survivors who had completed treatment within the last 5 years and had had clear scans into a screening study that looked for dormant tumor cells in participants' bone marrow. If dormant tumor cells were found, patients were then eligible to enroll in phase 2 CLEVER clinical trial, which randomized patients to receive 6 cycles of either monotherapy with one of 2 study drugs or combination therapy with both drugs. The treatment cleared dormant tumor cells in most patients after 6 to 12 months. This is just so cool.
Yeah.
After a median follow-up time of 42 months, only 2 patients on the study have experienced a cancer recurrence. This is very
great
cool
for the survivor.
Yeah.
The team is already enrolling patients in 2 larger ongoing studies to confirm and extend the results of the CLEVER study, CLEVER, it's an acronym. The phase 2 ABBY, probably, I wonder if that's ABBY clinical trial, and the phase 2 PALAVI clinical trial, available at several cancer centers across the country. Patients interested in learning more about these or other breast cancer clinical trials at Penn Medicine should contact, here's an email, breast cancer clinical trials, plural, breast cancer clinical trials at Penn, 2 N's, pennmedicine.upenn.edu.
Very cool.
Comments. I think we're going to leave that in the comments, so you'll have that email address. All right, folks.
This is a feel-good story, definitely.
Yeah.
So,
thanks for joining us. We'll talk at you later.
Take care, everyone. Thank you. Okay.